Do you find yourself overly stressed, tired, and even notice weight gain despite not changing your diet or your workout frequency? Your cortisol level may be out of whack. More specifically, they may be too high. Cortisol is often called the primary stress hormone because it's one of the main hormones that we release when we're under any sort of pressure, and our evolutionary-based fight-or-flight response kicks into gear. Although most of us think that cortisol is a bad thing, such as contributing to acne, weight gain, or high blood pressure, there's actually a lot more to cortisol levels than just our stress response and its unwanted symptoms. We need cortisol to live. While producing cortisol is a necessity for life, and it helps keep us motivated, awake, and responsive to our environment, maintaining abnormally high circulating cortisol levels can become dangerous, and it can contribute to long-term problems. Long-term use of corticosteroids and chronic stress are two of the biggest contributors to high cortisol. Chronic high cortisol production is tied to symptoms and ailments including weight gain, anxiety, sleep disorders, hormonal imbalances, and fertility problems, in addition to many other conditions. The good news is there's many natural ways to get your cortisol level in check. For instance, adaptogenic herbs are known to lower cortisol, and that's just the tip of the iceberg. You can greatly help to manage your cortisol levels and regain your health by changing your diet, exercise routine, sleep, and stress levels, assuming you haven't been diagnosed with Cushing's disease by your doctor. Poorly managed blood sugar levels, especially hypoglycemia or having low blood sugar, and high levels of inflammation can contribute to high cortisol levels and other hormonal problems. Following an anti-inflammatory diet, low in processed foods and high in antioxidants, fiber, and essential nutrients is key to balancing hormones, controlling your cravings, and getting you on the right track. These same strategies can also help with adrenal support, allowing you to reach and to maintain a healthy body weight, boosting energy during the day and helping you sleep better at night. Some of the most significant dietary contributions to inflammation and high cortisol level include high sugar, high glycemic diet, consuming high amounts of refined and trans fats, drinking too much caffeine and alcohol, experiencing insufficient intake of micronutrients and antioxidants, not consuming enough fiber, which makes it hard to balance your blood sugar, and not consuming enough healthy fats or proteins, which can lead to hunger, weight gain, and high blood sugar. You want to switch to low glycemic diet, which includes healthy fats and proteins with every meal, and to make sure that you get enough fiber and phytonutrients by eating plenty of fresh fruit and vegetables. Some of the most useful foods for lowering cortisol and stabilizing blood sugar include vegetables, fruits, coconut or olive oil, nuts, seeds, lean protein like eggs, fish, and grass-fed beef, and probiotics like yogurt, kefir, and cultured vegetables. Chronic stress is now linked with just about every health problem out there. Stress affects most people at least to some degree, and it impacts health by sending chemical signals around the body, including to the heart and the blood vessels, the immune system, the lungs, the digestive system, sensory organs, and the brain. Stress has the power to increase breathing, heart rate, pain, and muscle tension, your appetite, including overeating, and sleep-related problems. Fortunately, stress management is something that you can begin without too much trouble. The natural stress relievers listed below are proven to help lower cortisol and to decrease the negative impact that stress has on your health. Meditation or mindfulness. This practice has been shown to help to train the brain and the body to turn off the stress response and to promote more relaxation. And these benefits are possible without impairing alertness, concentration, or memory. Many studies show that daily meditation or even healing prayer for just 15 to 30 minutes can offer significant reductions in cortisol levels. Participating in a regular mindfulness-based stress reduction program also offers significant reductions in cortisol and stress-related symptoms or diseases. Using meditative methods can also improve brain and heart health while bolstering your immune system. Trusted for thousands of years in traditional Chinese medicine, acupuncture treatments help to naturally control stress and reduce symptoms like muscle or joint pain, headaches, fertility problems, trouble sleeping, and poor circulation. Taking deep breaths helps to turn down the sympathetic nervous system and kick in the body's natural relaxation response by activating the parasympathetic nervous system. Diaphragmatic breathing is an easy technique to learn on your own and to practice throughout the day to relieve muscle tension and anxiety. Controlled breathing techniques have been a staple in Eastern health practices for centuries, and they're becoming more popular in the West too, thanks to emerging studies and books describing their benefits, such as Dr. Herbert Benson's book, The Relaxation Response. Studies show that the physical setting plays a role in stress reduction, and being in nature is a well-documented way to promote relaxation. Try going for walks or runs outside, especially barefoot running or walking, or practice earthing. Spending time at the ocean, walking through forests, gardening at home, or doing other things outdoors and away from technology to reduce anxiety. According to research published by Harvard Medical School, regular exercise, about 30 to 60 minutes most days of the week, depending on the intensity, is one of the best ways to manage stress, balance hormones, sleep better, and aid normal metabolic functions, like balancing blood sugar levels. The key is to avoid overtraining and overexerting yourself, which can actually cause even more cortisol to be released. Exercise benefits hormone levels because although it temporarily increases adrenaline and cortisol production, it generally helps bring the cortisol back down to normal levels afterwards. This cycle helps your body to better handle stress and gives your autonomic nervous system, the one that controls your stress and relaxation responses, its own workout. This means the next time that your stress hormones rise due to a perceived threat, you should be able to lower the cortisol levels more easily since your body becomes primed due to the physical activity. Adaptogenic herbs help to naturally lower high cortisol levels in several key ways. They help to balance hormones, reduce inflammation due to their strong antioxidant, antiviral, and antibacterial effects. They have natural antidepressant effects. They lower fatigue, and they help balance blood pressure and blood sugar. Many adaptogens, such as reishi mushrooms and cocoa, have also been safely used for thousands of years to promote better overall health with little to no side effects. There's at least 16 different proven adaptogenic herbs that can help to lower cortisol. Some of these include ashwagandha, astragalus, licorice root, holy basil, medicinal mushrooms like reishi and cordyceps, rhodiola, ginseng, and schisandra. Similar to adaptogenic herbs, essential oils are also useful for fighting stress and balancing hormones. Essential oils include lavender, myrrh, frankincense, and bergamot, and they contain potent active ingredients that have been shown to naturally lower cortisol, reduce inflammation, improve immunity, and help with sleep and digestive functions. Try inhaling some of the best essential oils for hormones, diffusing them in your home, making bath soaks or body washes using your favorite kinds, or rubbing them directly into your skin when mixed properly with a carrier oil like coconut or jojoba oil. If you're dealing with side effects of high cortisol, including acne, indigestion, or bloated stomach, certain essential oils like lemon or peppermint can help with that. Getting enough sleep helps us to control cortisol production, but having high cortisol levels can make it hard to rest. In people with normal circadian rhythms, cortisol levels rise during the early morning hours and then drop very low at night, prior to sleep and during sleep. People who develop high cortisol levels can wind up feeling the opposite, wired and anxious at night, but then fatigued during the day. Thus, they can't sleep well at the times that they're supposed to. This overactivity of the adrenal glands is one of the biggest signs of Cushing's disease, or adrenal fatigue, and is usually tied to stress and hormonal imbalances. By taking the steps listed above, you should be able to rest more easily. Ideally, you should aim for 7 to 9 hours of sleep per night to reset your circadian rhythms and bring hormones back to balance. The adrenal gland, following signals from the hypothalamus and the pituitary gland, is responsible for the secretion of cortisol, a type of essential glucocorticoid steroid hormone. Cortisol levels are highest in the morning, around 7 a.m., and lowest at night. This is called a diurnal rhythm. Cortisol is also present in both chronically stressed individuals and those who are perfectly healthy. This vital hormone possesses dozens of different purposes within the body, and it makes numerous chemical interactions every single day. Cortisol receptors are scattered throughout the entire body, found in nearly every cell, and they serve different essential functions, like helping to keep us awake and alert, preventing fatigue or brain fog, keeping our metabolism running. It helps us to burn fat for energy. Balancing blood sugar levels, since it allows cells to take up and to use glucose for energy. Reducing inflammation and helping with healing. Balancing fluid levels based on salt and water intake. Contributing to the control over blood pressure. Helping with many cognitive processes like learning and memory formulation. Allowing us to respond to and escape from perceived dangers, and helping to develop the fetus during pregnancy. Levels of cortisol rise when the pituitary gland releases another hormone called adrenocorticotropic hormone, or ACTH. The ACTH signals the adrenal to pump out more cortisol. Why does this happen? Many different things can trigger this release, including various forms of physical or emotional stress, a poor lifestyle, too little sleep, or an illness or infection. When the pituitary or the adrenal gland produces abnormally high levels of cortisol for a duration of time, a doctor, perhaps an endocrinologist, may diagnose a serious chronic disorder called Cushing's disease. Cushing's disease is usually caused by tumours on the adrenal gland or the pituitary gland, and often causes symptoms like rapid weight gain, a swollen face, fatigue, and water retention or swelling around the abdomen and the upper back. It impacts women between the ages of 25 to 40 most often, although people of any age and gender can develop this condition. Diagnosable Cushing's disease caused by an overactive adrenal gland is considered much rarer than just having generally high cortisol levels. In other words, you have a much greater chance of experiencing high cortisol at certain times due to an increased stress in your life than you do ever from being diagnosed with Cushing's disease. While people experience at least somewhat high levels of cortisol at one time or another during very stressful episodes, such as a job, family crisis, or a major change, the rates of Cushing's disease diagnosis are still very low compared to other hormonal and endocrine conditions like thyroid disorder or diabetes. It's estimated that Cushing's disease impacts between 10 to 15 people per million, but comparatively high cortisol levels above what's considered normal affects millions of people and most adults. While symptoms of Cushing's disease and high cortisol tend to be similar, those caused by Cushing's disease are usually more severe, last longer, and more often cause other complications. To clear up confusion about terminology, Cushing's syndrome is not the same as Cushing's disease. They're similar but also different conditions. Cushing's syndrome is less serious and it refers to the general state characterized by excessive levels of cortisol in the blood, while Cushing's disease is the condition caused by a pituitary tumor that secretes the hormone ACTH, which then causes excess cortisol. On the other hand, the opposite of having Cushing's disease, experiencing abnormally low cortisol levels, can result in a condition known as Addison's disease, adrenal insufficiency, or adrenal fatigue. Addison's disease is also rare and is considered a type of autoimmune disease, since it causes the immune system to attack the body's own healthy tissues. In this case, tissues within the adrenal glands themselves become damaged and inflamed, which alters how the adrenals produce hormones. Certain symptoms of Addison's disease are essentially the opposite of Cushing's disease, since they're caused by a deficit in cortisol rather than an excess. Addison's symptoms can include fatigue, weight loss, muscle wasting, mood swings, and changes to the skin. Symptoms of adrenal fatigue can also be similar. According to research done by the Genetics Learning Science Center, the long-term danger of having high cortisol is that it activates the fight-or-flight response, which temporarily shuts down normal reproductive, digestive, and immune functions. The body targets these systems for shutdown because it doesn't need them for immediate survival. Sensory nerve cells pass the perception of a threat or a stress from the environment to the hypothalamus in the brain. This signals the pituitary and primarily the adrenal glands to produce more cortisol. If this cycle goes on for too long, someone becomes more susceptible to all sorts of illness, infection, and hormonal problems. Some clues that may signal that you're living with high cortisol includes weight gain, especially around the abdomen and the stomach. This can happen despite not changing your diet or your exercise routine. A puffy or flushed face, mood swings and increased anxiety, fatigue, including feeling tired but wired, and trouble sleeping normally, irregular periods and fertility problems. Chronic stress drives pregnenolone and progesterone into conversion into cortisol, and this competes for the precursors available for synthesizing other important hormones like DHEA, estrogen, and estradiol. This is known as the progesterone-pregnenolone steal effect. High blood pressure levels. The cortisol narrows the arteries, while the epinephrine increases heart rate. You can have acne and other changes in the skin. Higher rates for bone fractures and osteoporosis. The cortisol can lower hormones like estrogen, which is important for bone health. Muscle aches and pains. There can be a change in libido due to changes in estrogen or decreased testosterone. Excessive thirst, increased urination, and a higher susceptibility to infections. The stress response can lower the immune system's functions. Cortisol tends to go up as a perceived stress goes up, so anything that triggers a negative mind state, things like anxiety, worry, anger, or frustration, can contribute to high cortisol levels. Medication use, inflammation, poor sleep, and a poor diet can also trigger high cortisol levels by altering hormonal balance and negatively affecting the immune system. Corticosteroid medications like hydrocortisone, prednisone pills, or other medications used to treat inflammatory-related diseases or symptoms can be common causes of high cortisol levels. Aside from corticosteroids, other major factors contributing to higher than usual cortisol production can include depression, over-exercising or overtraining, nutrient deficiencies, addiction like alcohol or drug abuse, and higher than normal estrogen levels. Also, malnourishment and eating disorders, severe kidney or liver disease, hypothyroidism, obesity, pregnancy or birth control pills, recent surgery, illness, injury, or whole body infections, which can all trigger inflammation. Your doctor can order a number of tests to determine if you've abnormally high cortisol levels. Both blood and urine testing help to reveal a problem, but a 24-hour urine test is used more often than a cortisol blood test to diagnose Cushing's disease or Cushing's syndrome. The cortisol values listed below, which can be obtained from a blood test, serve as a reference range for what's considered normal. Cortisol levels above the normal range are considered high and can be risky or problematic. Keep in mind that values differ depending on the time of the day, the age, and the type of cortisol test performed. Saliva tests are now also recommended and appear to be as reliable as a blood sample. Additionally, an overnight dexamethasone suppression test may also be recommended, and it involves taking a dose of a corticosteroid medicine called dexamethasone in order to determine how blood cortisol level is affected. Because of this, your doctor will always need to evaluate your results in light of your specific symptoms and your medical history. Normal cortisol ranges for adults and children in the normal are between 5 to 23 micrograms per deciliter, or 138 to 635 nanomoles per liter. Normal cortisol ranges for adults and children in the afternoon are between 16 micrograms per deciliter, or 83 to 441 nanomoles per liter. And normal cortisol for a newborn baby is between 2 to 11 micrograms per deciliter, or 55 to 304 nanomoles per liter. If your test results reveal that you're at risk of Cushing's disease or Cushing's syndrome, you'll be treated dependent on what's causing your cortisol levels to rise in the first place. Cushing's syndrome and Cushing's disease are most often caused by a benign tumor growth on the pituitary gland, called a pituitary adenoma. Cortisol-like synthetic medication use and the cortisol-increasing lifestyle factors mentioned above can also be addressed by your doctor if they're contributing to your symptoms. A high percentage of people with either Cushing's disease or Cushing's syndrome display at least small tumor growth on the pituitary gland, and they need to have these removed with surgery or reduced with medication and lifestyle changes in order to resolve the cortisol-related symptoms. It's important to talk to your doctor if you suspect that you might have Cushing's disease or syndrome to assess whether or not you need to discontinue or lower your use of medications that increase cortisol, such as steroids, undergo life-saving surgery to remove a tumor, or use radiation or medications to shrink a tumor. However, keep in mind that these are very rarely needed interventions, and most people with high cortisol levels are able to manage their condition naturally without any surgery or any medication. Although cortisol is often viewed as a bad actor, we need it to live. The problem is medications, a lack of exercise, processed foods, and high stress levels can leave us living with too much cortisol in the body. In rare cases, a usually benign tumor could be the root cause of a high cortisol level. Your doctor can order routine tests to determine your cortisol levels and suggest ways to lower it.